If we can do our roll call, please.
Yeah, Commissioner Roberts,
Present.
Commissioner Zunino. Present. Commissioner Morale.
Here.
Commissioner Davis.
Here.
Chair Gonzalez.
Here.
All present.
Great. And from, this is very loud. And for what I can see, we have our public comment. Is that correct?
Your microphone isn't on.
So what I can tell, it looks like we're up for public comments for any topic that is not currently listed in our agenda. So if anyone wants to come forward and speak, you get 3 minutes to do that.
Everybody. My name is Angie Regan. This is Simba. I am from Peace Love Tahoe, Access Tahoe, and I'm a volunteer for the American Foundation for Suicide Prevention. I've requested a proclamation from the City of South Lake Tahoe for both Suicide Prevention Month and Recovery Month for September. And I just wanted to request your support of these causes during and beyond September. Deaths of despair include lives lost to suicide, drugs, alcohol, and alcoholic liver disease. We have lost too many lives to despair in our communities and in all communities. I'm hoping you will use September as an opportunity to bring increased awareness, attention, training, and understanding to both suicide prevention and recovery within the police force, the police commission, as well as extending out to public awareness. I struggle openly with chronic severe suicidal ideation. I heal out loud for those who heal in silence, and all the time I healed in silence. In my struggle, I've honestly not had the best experience with the police force or the police commission. Yet I remain hopeful for change, partly due to occupational stress and PTSD. Police officers also have a 54% greater risk of suicide than the general population. Police are also twice as likely to abuse alcohol than the general population. Between 20 and 30% of police officers have a substance use or disorder compared to less than 10% of the general population. I hope for less stigma, judgment, criticism, and hate around these topics. I hope for more compassion, empathy, and understanding and support throughout our entire community for every life, including mine. I hope you can help too. The American Foundation for Suicide Prevention will be back in mid-September, and so I hope you guys can come for events and training and just use it as just bringing more awareness to the public and to the police force and to our community. Thank you.
Thank you. Are there any other folks who would like to give public comment on items not listed on the agenda today? Sorry, is working on the button. Okay, are there anyone on Zoom?
We don't have a Zoom platform.
Okay, with that then, we can move on to regular new business. Is that correct? And it looks like the first item is the motion to pass the minutes from last month. Does anyone want to make a motion?
Actually, we first need to take, does anyone want to provide public comments on the minutes from our last meeting? None? Now we can accept a motion.
Yeah, and I wrote the note that that's what we're supposed to do, and I skipped my own notes. So does anyone want to make a motion to pass the meeting minutes from last time?
I'll make a motion.
Anyone want a second?
I second it.
Great. Then we can now vote.
Hold on a second. That motion unanimously carries. Thank you.
Thank you so much. And then next on the agenda, we have our presentation from Stax.
Thank you, Chair and Commissioners. I just want to take a quick minute to introduce this presentation. First off, I just really want to thank the community partners that made it here today in support of this presentation. I really appreciate the time. I know they're very busy. So Also want to take a quick minute to introduce Officer Matt Hazlett to the commission. He's been our full-time stacks officer for the South Lake Tahoe Police Department since April of 2023. He's been doing an outstanding job. They all have, and their continued collaboration for this collaborative working group. So without further ado, Officer Matt Hazlett.
Hi, so I'm Officer Hazlett. I'm the stacks officer with the South Lake Tahoe Police Department. I'm going to talk about what stacks is and what we've been doing, and I've brought a handful of my community partners with me to help answer any questions you guys have afterwards. So, like I said, we're going to talk about stacks and partners. Kind of the two things I deal with the most are the unhoused population and mental health response. So we'll briefly go over those, and then we're also going to talk about some of the things that we've done so far. So STAC stands for South Tahoe Alternative Collaborative Services, and that is exactly what it is. It is alternative services that I use to handle just things in the community. Oftentimes when there's problems in society or within a community, it falls on the laps of law enforcement. And STACS is an attempt to try to mitigate that. And we mitigate it by working with partners within the community. Some of the partners, a lot of them are here today, is El Dorado County Behavioral Health, Barton Hospital, Tahoe Coalition for the Homeless, Fire Rescue, the Sheriff's Office, and the District Attorney's Office, and there's many more. I could probably fill out 2 more slides and still not list all of them. So we work with a lot of different people. For the unhoused population, I focus on housing stabilization. I do that through the coalition, drug and alcohol rehabilitation, the shelter, and when I say shelter, if I refer to the shelter, I'm usually referring to the one down in Placerville, and then family reunification. For mental health, we do a joint response with El Dorado County Behavioral Health, where we're actually going out into the field and doing follow-ups on some of the more severe mental health cases that are out there. So we'll respond with a clinician and going out into the field for that. Here's some of the stats. I broke it down by months. This goes from April of 2023, which is when I started this position, until July 2024. In that time frame, I handled 1,394 calls for service. It's probably hard for you to see there, but the blue is transient calls, orange is mental health, and then the gray is patrol calls. So just normal calls for service. I've drafted 191 reports and made 77 arrests in that time. For housing, basically I make a lot of referrals, and that's how we try and get individuals housed. With the coalition, since I've started, same time frame, April till July. Through the coalition, I've housed 35 people. Through the shelter, which is the one down Placerville, 16 people, and 4 with family reunification, for a total of 55. I spoke with the coalition a little bit leading up to this and got the numbers of, we've had 108 referrals from me to them, and together, looking at our numbers, we're tracking about 116 active transients still within the city, but that changes a lot day by day. So that's kind of my presentation there. I've also brought a handful of my partners. I will let them kind of introduce themselves and tell you real briefly what they do and how we work together. If you want to just come up, yeah, one at a time, sure. However you want to do it. Yeah. Can you hear them if they talk from there?
They need to come up and speak into the microphone.
Okay, sorry guys. Sorry, go for it.
Formally. Hi, I'm Ari. I'm a mental health clinician with El Dorado County Behavioral Health.
And I'm Karen Torrey Green with El Dorado County Behavioral Health.
Hi everyone, I'm Dr. Aubrey DeMay, and I'm the adult psychiatrist at Barton. And I'm Dr. Elizabeth McNamara. I work in the emergency department at Barton, and I also do outpatient addiction treatment.
Hi, good afternoon, everyone. I'm Kimberly Peterson with Tahoe Coalition for the Homeless.
So I work with each of these individuals in a lot of different capacities, and that's why I brought them here to kind of help answer questions. And that concludes my presentation. Thank you.
Thank you so much, Officer Hazlett. And even though this is Police Advisory Commission, only the chief is a police officer. So we promise to be a little gentle. Does any of the commission have questions?
I do.
Go for it.
But I feel like I always go first, so if someone else wants to go first. All right. Yeah, so I understand that you have a team of 2 that operate together as one sort of unit.
For stacks?
Yeah.
No, it's just me.
I remember a presentation from the LLT where you guys.
Oh,
got
with her,
together,
I'm sorry,
yeah.
for mental health, yes.
For mental health
Yes.
calls, right.
Yeah.
And one thing that sort of struck me was that, that's one shift. Are there any plans down the line to add more mental health professionals or whatever to add shifts into rotation? Because you guys seem great, but I don't know if you can work 24/7.
Yeah, so what we've done, I worked with the County Behavioral Health, and they have like an on-call clinician, and they have like a schedule of who's on call on what day, and they'll come out, whether it's with me or any other law enforcement officer that needs assistance that thinks that, hey, we could use a clinician here on scene with us.
So you are able to cover the spread.
Yes, ma'am.
Cool.
I can also speak to that. We're working currently on a mobile crisis unit, and that will be 24 hours. So we're working on the contract now. We're hoping for sometime in 2025. The biggest restrictions, as you might be aware of, is the time frame. So getting people to stay awake all through the night to handle crisis, but it's in the works. Yeah.
I think one of the most active questions in the community is how we're handling the homeless population. Can you all talk a little bit about, how you're dealing with that from STAC's perspective, and if any of those leads to arrest, like under what conditions would that lead to an arrest?
Mm-hmm. Yeah.
And then also, sorry, I'll just tack on so you don't have to keep coming back and forth.
Yeah.
It's just a little, when you are sheltering, can you explain a little bit more about the shelters and where people are able to be housed in like maybe long-term and short-term?
Mm-hmm. Yeah. For the last part, I'll have Kim help. For the first part, so the way we address the problem is it's housing first. So I should say resources first, right? So when I come out and I contact like a camp or an individual that's homeless, we're going out there to offer resources. I had them listed, before, whether it's rehab, referring them to the coalition, the shelter down in Placerville, or family reunification. If there's a crime committed, obviously we have to address the crime as well. But kind of one of the big points of my position is trying to have that, it's almost like a balancing act of when do we just enforce and when are we just helping? And a lot of times the answer is very much in between the two. Yeah, if you want to answer the last part, that'd be great. Thank you.
Totally. I can say that this has been one of the best, most collaborative relationships that we've ever had, not just in the coalition, but in all the years that I've been doing this work in multiple communities. Officer Hazlett and the program that they've built has been really fantastic, to where, when myself or my staff goes out and does outreach with them, the goal is never to arrest someone for unlawful camping, something like that. They're always going to do a warrant check. They're always going to make sure that on its face, there isn't a crime being committed, because ultimately that's their job, is public safety. And, that's not something that we are concerned about. Like, we use them for the same resource, and that if we have someone that is staying at our shelter that's clearly committing a crime and we need help, we will call him with that as well, because we are not law enforcement officers as social workers and case managers. So currently, Tahoe Coalition, we are also the coordinated entry provider, and so we do intakes for everyone throughout the entire county. And when there are beds available or spaces available, we make referrals to programs. So we have the county has a couple of permanent housing options. We have our 3 motels here in South Lake Tahoe. We have a couple of rapid rehousing programs. All of those programs are based on vulnerability, and based on HUD guidelines and state programs, things like that. As far as immediate sheltering, there's the 60-bed navigation center in the county. 54 of those beds are law enforcement referrals. So, if they have a bed available of those 54, Officer Hazlett can take the person down there. That's, taking him a couple of hours out of his day to take them to Placerville and back. And so I think the majority of the referrals they get down there come from the HOT team and probation in Placerville. So then 6 referrals come from coordinated entry. Again, that is countywide for everyone, and that is from the most vulnerable folks at the top. So there will be some folks that will never receive a referral to that navigation center from coordinated entry. The other option that we have going on right now is last winter, we had a shelter that was being funded through the Continuum of Care, which is the group of different partners, nonprofits that work on homelessness in the entire county. But that was only funded from December 28th through the end of April. And so we had 14 beds at our Red Lodge location, which is over on Emerald Bay by U-Haul. If you haven't seen that building or know, it used to be a drug and alcohol counseling facility. So upstairs in the main building, there are dorm-like rooms. So with some double occupancy, some single occupancy, one room that has 4 people in it, we did some sheltering. Now, we still had snow into June. We didn't have money into June. And so not just that, but then also we have some folks in there that 1, were very close to being housed, or 2, very sick individuals that if we put them back outside, which was what we really were supposed to do, they likely would have died. And so, with a little bit of asking for forgiveness to my board, we've kind of figured out how to keep those people inside. And so we currently have 16 people there. 4 of them are elderly women who were evicted wandering the streets that, both the fire department and PD got phone calls like, why is a 71-year-old woman just walking around the streets? So very unfortunate events, lots of, our community just in general needs to do better when it comes to those things. But we are currently housing those, temporarily sheltering, I should say, 16 people there still with CalAIM funding, which is an initiative through the state of California. Those are dollars that we earn, and we have many things that we could be using them on. If you've seen our parking lots, they have giant holes, but we are currently using them on the shelter because we really do feel that people need a safe place to go. And our partners need a safe place for their individuals to go when they're in the hospital, when they are in a situation where their tent, all their stuff was stolen. And so come November, that will be again funded by the Continuum of Care, and that will be through May, and I'm hoping that we can continue to work between city, county, other partners to keep that funded year-round. It's been very successful, and again, with reunification with families. So we did some reunification with the stats that were listed there, but we've done some additional reunification outside of the STACS department, also, just all kinds of programs. We're looking for anything and anywhere that our people fit into, whether that's rehab or board and care or, some people will self-resolve sort of thing. So our goal is just to get them permanently housed.
Thank you. Didn't mean to yell into that. You mentioned you're hoping to keep funding. Is there anything that we can or should go to the city council with in our report that you'd like us to, or is there any, I don't know how much our support helps, but is there anything that would be helpful? And this is for anyone here, because this program seems to be a very successful program. You guys all seem to be working really well together, that we can and should put on our agenda to take to city council and.
Yeah, I mean, we absolutely want to continue to fund the Stacks position so that we have that liaison because, again, they help us in so many ways with our folks that are housed, with our folks that are sheltered, and coordinating with probation, parole. I mean, it's really a group effort in everything that we do every single day. So having a fantastic partner and also the chief, I mean, it's the police department in general who's been really great. But also having a place like the shelter that we're providing, even 16 beds is not enough. We are often full. We get calls from Barton and calls from PD and fire wanting to drop somebody off. And we often have to say, you know, I'm sorry, we don't have somewhere for them to go. I mean, I think that's a bigger picture. I don't know. We don't have any more space for anyone, but being able to fund that year round, I think is important, not just during the winter, particularly if we're looking at really displacing people that are out in the community. You know, if we're wanting them to get out of the meadows and off of the street, like they have to have somewhere to go.
Just a quick follow-up on that point. Like on average, how short are you? Like on any given night, do you know? Like, are you another 16? I mean, obviously we have a big housing issue here. It's a huge debate, but like on any given night, are you usually short another 16 beds? Or are you short?
No, I would say that, so we, for a while, had been full, and then we all of a sudden we just housed a bunch of people, and so we had some turnover. But for like, I think 2.5 months, we didn't have any space, but we were getting probably 2 calls a week from Barton. And then, you know, I'd get a call from Officer Hazlett of like, hey, I think this person, I'm gonna go try to find them again. Do you think you could possibly find a spot for them? And we really, you know, we're not putting people in the lobby on the floor. We have a big community room that we've decided to keep for the participants, for them to go and play games and use the computer and eat. Like, we could set up more beds in there, but that is just chaos. And so unless we had like a big storm where people's lives were really at risk, we're not willing to do that. I mean, 16 already in a small space is a lot of folks. So, you know, I would say if we had 5 more beds at any one given time, that would be helpful. In the past, we've also had access to motel voucher funds, which we don't currently have, and that is through the federal government, and actually our county was not given the dollars in for 2023, 2024 because it's all based on levels of poverty, and poverty went down during the pandemic in El Dorado County, and so then we lost dollars for things for social programs. That will likely change as people that came to the community leave. To where it gets back to the numbers that it was at. Not that poverty's increasing, but it will get back to the numbers that it was at pre-pandemic. And there will be that, hopefully, that influx of dollars again, so we have the ability to do short-term motel stays for families, for people that are elderly, like, or, you know, we plan to reunificate, you know, with family and just need for them to stay somewhere for a couple days.
I would just like to say thank you for the presentation, for the work, Officer Hazlett, that you're doing, for the, you know, the partnerships you're creating and developing in our community for our community members. Thank you for doing that. And if we could hear just maybe a little bit from you, if I understand this right, I think you're a little over a year doing that. Do I have that correct? Yes. Okay, so a relatively new idea, right? So as you reflect a little bit over the last year plus, lessons learned, or on the other side, anything else, right, that would you see as on the need side of it that you would like to think about going into this next year?
Well, a second Stacks officer would be great. It's a lot of work. I think over the last year, what I've learned is that all these different problems it's a big issue, and that each individual is a completely different case, and each person that I work with, their needs are going to be completely different than the person's before, and so it's really kind of hard to like put it in a box of like, these are, you know, things I could really use or do. It's kind of figured out as we go, and whether it's someone in a mental health crisis, like a long-term mental health crisis, or it's a homeless camp that has, 10 people in it and it's an environmental disaster. Each one of those requires time, effort, and just figuring out what the best course of action is. We talked about mobile crisis a little while ago. I think that's a great dream for someday, and I hope it comes one day and we can use it. Yeah, but I think it's kind of hard to pinpoint one or even a handful of things. I think you just have to have the will to do it and the ability to make the partners to figure out what the problems are. So
Appreciate your response, and look forward to seeing how it continues to develop and hearing back. It's a good thing for our community, so thank you very much.
thank you.
Chair Gonzalez, could I interrupt real quick? We had a partner who's been with me from ground level, came in a little bit late, so I'd like to give him a chance just to introduce himself, because he really has been, I'm not calling you out because you were late, but he really has been a good partner. So anyway, come on up and just tell him who you are, because he has been here from the beginning, so.
How's it going? Hi, Chris Proctor for the record. Sorry for being late, Chief. I promised I would never do that. Sorry about that. Hi, Commission. I really appreciate the opportunity to come here and just really join in on what's been said. I think Chief Stevenson reached out to me probably the winter of 2021 with this crazy idea for a STACS program. And we worked through a lot of the bureaucratic or regulatory barriers, because ultimately with this situation, you need to have everybody with the right amount of communication ability to do the right thing in the right time. And sometimes because there's protected health information and other things we want to protect, that takes some work. So that was really a lot of early work that we did. And then we kind of got into the actual operations of it. And I think back to, at first why I think Barton was invited was because in the healthcare system, you have this thing called a preventable ER visit. And a preventable ER visit is essentially a time where somebody ends up in the ER because there's nowhere else for them to go. Now, if it's emergent or urgent, then it's appropriate. But sometimes we find that it's not. And so some of our partners here have probably had the situation where they have a community member that has nowhere else to go. It's cold out. Let's go over to the ED. Certainly we're equipped to do that, but it's not the best use of that service. And so this type of program really helps to intervene in the right way to keep that from happening. And that's what my initial, I think, interest was. But then as you get involved in it, you start to see the good that it does and the ability to help those that truly are in crisis avoid some of these terminal destinations, if you will. And in some ways, Chief Stevenson and I talked over the years, there's an analog here. Our emergency room is kind of like a jail. The jail is equipped to take care of what it needs to take care of, just as the ER is. But if you can intervene along that pathway and you can stop that process the right way, then everybody benefits. And that's what's been most enjoyable about being involved in this program. Having Officer Hazlett come into the team has been a great addition. I echo what you had said, Mr. Zanino. He's taking a starting point and really created a place to just spring up to a whole new level of service. And so from both Barton's perspective, but also my own personal perspective, it's been a great thing to be involved in. We look forward to continuing to be involved in it. And so just really happy to be here. And again, apologies for being late. Thank you.
Yeah, Officer Hazlett, they mentioned the 4 elderly women that were found on the streets. I was wondering how many of the senior citizens are that 116 out there, and is there any additional or specific services that you collaborate with to help them, or are you working with the senior center? Are they able to help at all?
Yeah, so I don't have that number available now. I'm sure I could dig through some stuff and figure out what the exact number is. I did work closely with Kim on those 4 individuals. I work closely, it's kind of a combination like what Kimberly said earlier. Sometimes I'm just calling and being like, this is what I have. I really need somewhere to put this individual. But I also work really closely with APS, the Adult Protective Services. And all those cases, you know, obviously an APS report was filed and they were involved in, you know, getting them housed and all that. And then I also work with the senior center here for a multitude of reasons, but I'm pretty familiar with them as well. And just things like getting people meals and making sure people know about the services that they offer as well. So.
Thank you.
You're welcome.
Chief, and Officer Hazlett, it's only been a year. Have you all seen a correlationship between a drop in arrests and the implementation of the Stacks program? Are you able to see that yet? Are you able to see holistic, concrete changes? Because I think you're doing a lot. I'm just wondering, and compared to the overall stats we usually look at, how they're stacking up against each other.
Pun intended. That's a difficult question. I think that the first year we noticed homelessness calls went down, and as our last annual report, those calls went back up. Mental health calls, I don't recall off the top of my head. I think they stayed kind of level and or went up. The difficult part is I don't know holistically from a broader perspective if homelessness is getting worse. I'm told it is across the state sometimes. I also, what's the trend of mental illness? I don't really have the broader number. So is it all increasing? People, it's going up. I'm getting the people who know and deal with it every single day. That's the trend I've heard also. So, and Kimberly's standing up, so she wants to add something too. And doctor, feel free if there's something you could throw into that. I would appreciate
I just
it.
wanted to add that, you know, like Chief was saying, that over the first 3 years that we were really tracking this, calls related to folks experiencing homelessness went down over 56%. However, last year we saw that they went up, but the problem is he's like literally going out looking for people. So when you're tracking it in that way versus like people calling in and saying, hey, I have this person outside my business, or I was out hiking and I saw this encampment, like that was how it was tracked before. Now he's like, I had 1,900 interactions. That takes those numbers like up to a crazy number because he's literally outside looking for people. So I think, you know, when I saw that, I was like, what is happening? And so we are going to have to figure out some way to track things differently, of like calls for service from the community versus interactions when we're out actually looking for people. Because it's also just not on his shift, but sometimes there'll be planned outreach with, whether that's with behavioral health or with the coalition, of like, okay, so we're going to set aside some time to go out to different parts of the community and just kind of see who's out there.
I guess the reason I asked this question is because as a commission, we're supposed to be advising the city, right, on what law enforcement should be doing. And I can imagine a situation where the city then has concerns of effectiveness. Mm-hmm. I think in hearing you all and hearing such a positive relationship, we can generally like hear anecdotally that things are going well, but likely I can imagine over time when there's requests for more funding, as there, I work in nonprofit, so also know that when you request more funding, you have to have more justification. And I don't feel the need to know it now. It's just something I anticipate. If y'all get scrutinized more, what they would be looking to see some correlations between how people are being sent to jail more or less as a direct result for Stacks. It sounds like overall, though, we're seeing the positive relationship, and I think that's really helpful, but it's just something to consider as people want more advising of the police, which is our role.
So one of the things that I really love to share is when I sit down with different law enforcement agencies, whether that's South Lake Tahoe or the HOT team or City of Placerville, is they'll be like, oh, I wonder what happened to John Doe. Like, that guy was such a pain and always causing problems. I'm like, well, he lives at our property. And so that's why you don't see him out causing problems, because he's been housed and he is doing extremely well. So, I mean, I think that they probably each have a list of individuals that were out on the streets for a period of time. Just, you know, they got calls for service for that person all the time, but now they've been successfully housed for a couple of years. So, I mean, it's definitely working, and that's also the need for additional shelter beds and additional housing for people to go to.
I can speak to the mental health aspect, so housed or unhoused. I think the issue with mental illness is often it's more complex than typical physical ailments. And so how it often works between Officer Hazlett and I and El Dorado County Behavioral Health is that there will be someone oftentimes housed who will have never found their way to me in my office because they don't see a problem going on, right? Or that it's just there's too many barriers to actually get to see me. So it's really important that we have these community relationships so that when Officer Hazlett knows this person exists, I can be looped in and I can help make the process to finding me easier. And oftentimes also, I would expect that over time, you would see more inpatient hospitalizations as a result of our collaboration, which might not look good, but is actually better. But this is such a multi-pronged problem. Inpatient hospitalization, they are often also full to capacity. So having many people with relationships where we can talk about where's the best place for this person to get help is just so essential. And there's just no question that mental illness is getting, unfortunately, worse. And mental illness is a very broad term. So whether you're talking about anxiety and depression in teenagers, which we know is at a catastrophic level of a problem, all the way to schizophrenia, and sort of even leaving out a huge issue of substance use. This is something that our community is going to have to figure out better and better ways of addressing. So yeah.
I think, like, on a personal basis, I'd like to advocate more for this program. And so my ask is, like, perhaps this is a space where we can brainstorm how to document it clearly in evidence, like start giving it evidence base for the city council to continue justifying increased funding. Because I think the anecdotal information is so helpful and so good. And yeah, definitely. Increase in inpatient care might look like a decrease in jailing for a specific, I don't know. I'm not a stats person, and I won't take out a hypothetical abacus to try to get the math done. I'm just, trying to brainstorm how we can really document this to cement it in the city as like a stunning budget item.
Yeah, and anecdotes here, they're not the same as data, and data would be amazing. And as much data as we can get, of course, that'd be great. But I think some stories are meaningful. And so, just thinking of one patient we've worked on together, when someone is in a psychotic state in their apartment building, causing mayhem for everyone living around them, but will not go to seek care. And between Aria and Officer Hazlett, they develop a relationship where over time, actually, they do see me for the first time in their whole lives. That's very meaningful, but there's no, where does the data come from that? That's really hard, because they weren't actually going to be arrested for anything, most likely. So, yeah.
If I could just also throw in, we've also recently entered into a partnership with Barton that's related to this in regards to the opioid settlement money. And we're excited as that moves forward as well and fits into this whole program. So it's roughly $100 and something thousand per year for the next 15 years. And I'm looking forward to that. So.
So I'm Karen Torrey Green with El Dorado County Behavioral Health, and I oversee the Justice and Diversion Program for the whole entire county. We were set up for 50 people to handle 50 people. So what happens is people get arrested, and when they go to jail, they're evaluated for whether their mental health issues contributed to the crime. I believe this law is 1001.36. And so the social worker who's with the public defender makes referrals to us. And then if the clinicians under me establish that the crime was committed due to a mental health issue, then we do something called the nexus, which says these symptoms caused this behavior. I've been doing mental health for about 30 years. And so a really good example would be if I was traumatized by getting beaten up and Officer Hazlitt is coming at me and I feel threatened, I would attack him back due to trauma issues. So that's a really good example of mental health issue contributing to a crime. And right now, our entire nation is in a trauma epidemic, known trauma epidemic. We're in a safer time than ever in the history of our history. But because of the internet and our brains being flooded with information, that's more information that we can process. Our brains have a way of jumping to conclusions. And if anyone wants a long-term discussion on that, I could talk about that all day. But anyway, so if you think about it, the diversion program was put in place really for a good reason. I mean, if someone's schizophrenic and they don't have any insight and they're trespassing, put them in treatment instead of putting them in jail. That makes sense. We at this time have about 150 referrals that we're processing, and we just hit 90 people in our program. We're supposed to handle 50. So we are completely and totally overwhelmed. And what I would like this commission to know is what we're seeing, and I've been a licensed clinical social worker in 5 different states now. I've never seen anything like it. But the substance abuse issues are out of control, and I don't see resources. The county itself is desperate for resources to treat substance abuse. Mental health is treated with certain forms of therapy, but substance abuse treatment is a long-term treatment, and it often requires medical intervention. And I just want to say that we as a county, we're not equipped to deal with the substance abuse issues. And so if somebody's committing a crime because of a substance abuse issue, the public defenders are saying, this is a mental health issue because it's in the DSM. And I understand that substance abuse is in the DSM, the Diagnostic and Statistical Manual, which is where all the diagnoses are. But we're not equipped to deal with it. And if I could just let you guys know that is my number one concern. The other thing I would like to say is that in El Dorado County and Placerville, the National Alliance of Mental Illness, NAMI, which is a grassroots organization all over the country, it's run by people who have mental health issues. It's for families of people with mental health issues. They have a lot of education, and they have something called the Clubhouse model. And they just opened their first clubhouse in the Placerville area. It's a place where people can go and learn skills. So people with mental illness can go, they can learn skills so that they can hold a job or do their household tasks or that sort of thing, or they can just plain socialize. Or they can sit around a fire. And the nice thing about the clubhouse from an economical standpoint is that if I have a choice between going to a clubhouse and sitting around a fire and getting maybe free tea or coffee, or going to the ER, I'm probably going to choose the clubhouse. The clubhouse is known to be economically a better choice than the emergency room. The emergency room is obviously the most expensive intervention for anybody with a mental health issue. So I don't want to say, oh, let's start a clubhouse, but I do want to plant that seed. If you haven't heard of a clubhouse, and let you all know that would be NAMI. That would be the ones that get that up and running. Thank you.
Thank you so much. Are there any other questions, or anyone else wants to speak? There's so many of you. I want you all to have the opportunity.
It kind of felt like my turn. So I can talk a little bit about substance use and what we're doing through Barton to help. So just like a little bit of background, and I'm sure you've all seen charts and data, but in 1999, I won't tell you how old I was, there were 5,000 overdose deaths. In 2023, there were over 100,000. And so, you see these charts with like the line going up, but those numbers just mean a lot to me. And so much of what we're talking about, sort of the current there is that people are struggling with substance use disorders. It's alcohol, it's opiates. I mean, we all know about that, right? It's amphetamines, and that is inextricably linked with their mental health, and it is their number one danger, right? It's the thing that's going to kill them. It's the thing that's going to cause them to commit crimes. And again, we can't distract this from their mental health issues, but this is something that over years working in the emergency department, you kind of just see this cycle, and you see so much stigma directed at people with substance use disorders. And where does it come from? It comes from a lot of things, but one of the things is that when you don't have any resources, you're far more likely to just push somebody away, right? When you don't know how to help them, you're far more likely to just other them. Like, well, if we don't have a treatment and we don't have resources for what you have, then what you have must be your fault. And that's just not the way that we're going to move forward. Right. And so there's been major revolutions in treatment. You know, it used to be you have to get sober to get treated. And now we've really left that behind. And we say, come to us in any state that you're in, and we can assess where you are and assess what your needs, and just start to, you know, we talked about this at our meeting last week, but we can start to treat you like a human and really see how we can help you. And I think that giving people interactions with healthcare providers that are humane and open-minded and destigmatizing and really person first is a huge way forward here. And I think that's been a big benefit of partnering with Stacks. You know, we started talking even before we had the settlement funds, like, hey, what can we do? Like, let's go out and talk to people. Like, how do we get people engaged in treatment? And now, you know, the snowball's not very big, but it's sort of rolling down the hill. And we're talking at Barton a lot about how do we expand access to care and how do we expand substance use treatment. So we're the most recent thing we've been talking about, which I'd like to enact within the next, you know, several months, is starting to kind of go to people. The classic medical model is when somebody is sick enough, they will knock on my door. And they will knock on the door of the emergency department at 3 o'clock in the morning. And that's just not the best context for care. It's a great way to engage people, but it's not a good way to sort of give them persistent ongoing care. So we're working on using the funds that we've gotten from the city, from the county, to expand access to care and create low barrier care for people with substance use disorders and engage them in treatment in a way that makes them continue to come back. So I tell people, you know, I don't care. I mean, I do care if you're using, right? But I don't care if you used yesterday or this morning. I want you to come to your appointment, and I'm not going to kick you out. And Officer Hazlitt's calling me, hey, I got this person, and they have this problem. Like, what do you need? And we're saying, just bring them to clinic, and we can start talking. And we made a lot of clinic engagements that way. And to your question, I think one of the things we can maybe track going forward is referrals into healthcare. Right, like how many people we're actually getting to see the doctor and how long we're getting them to see them, and what treatment are they getting. And then it's a very warm hand up too between Dr. DeMay and our addiction treatment services. Like, okay, this person has exceeded our ability. It's not just anxiety, depression, it's bipolar disorder, it's schizophrenia. We need more help. And so we're really able to kind of warmly come together and be like, I'm going to send you over to this doctor who can help. I'm going to send you to this doctor who can help. And just strengthening those alliances also with the community services is huge. And our substance use navigator is not here today, but she is a wizard at connecting people and telling them what resources to use, and talking to me, talking to Dr. DeMay, talking to Officer Hazlitt. Like, we're working hard to make sure that we can unify treatment services and get people the help that oftentimes they really want. Questions about that?
Can I ask a quick question, couple questions?
Yeah, please.
So you said expanding access to care, is that within that 100,000 a year, or is that outside of that?
It's both. So myself and another physician at Barton are specifically interested in providing addiction medicine treatment, and it's really a challenge to roll all of addiction medicine into primary care, right? Our primary care providers are sometimes tapped out when they address the hypertension and the diabetes. And so some people, probably a fair number of people, need referral to specialty care for that. So within Barton, we're talking about expanding just addiction medicine care services so that we have dedicated time for people to come there. Also with those funds, we're talking about how do we expand those services so that they're comprehensive. It's not just that you see the doctor, it's also that you talk to a social worker at Barton who can also talk to the social worker at the county, and we can have direct communication between those. So one of the things we're actively trying to do is hire an LCSW or LMFT to provide therapy within our clinical context. And another thing, like I mentioned, is, we've wanted to do this for a long time. We're really enthusiastic about building an outreach service, going into the community on a predictable basis and having people engage with the doctor. Hey, do you want to talk to the doctor about your blood pressure? Do you want to talk to them about your alcohol use? Do you want to talk to them just about your mom? Like, how can we help you to get to where you need to go in a really humane and engaging way?
So how is it grant funding outside of that 100,000? Got it.
Yeah.
So and how do those grants work? Is it like 2-year, 3-year, 10-year, or is it varied?
Yeah, every grant that we in sort of interact with is a different time and a different amount of money. And so, and we're really new at working with grant funding through Barton. We really had minimal grant interaction before we started with the California Bridge program in, I think, 2021. And I don't know how you're familiar with that, but that was our ability to hire a substance use navigator, which is our care coordinator for people with substance use disorder. And so every grant has a different period, different amount, and then also different sort of asks, right? Like reporting things, and what activities kind of fall underneath it. The good news is, because there's such an urgency to treat people with substance use disorders, a lot of it is like, go do the best you can with the resources that you have and report back to us. And so we're working with that to build it. It takes a little while to build these things. You know what I mean? Like, we get the money first, and then we say, okay, with this amount of money, with these need gaps, like, what can we do next? Because we really don't want to be putting money towards things that are not high yield and sustainable, right? We've all seen situations where you're like, oh, we're gonna build this beautiful thing and it lasts for a year. Like, we wanna make sure that this is long-term. Like, I wanna have a relationship with these patients for decades. Like, it's really important to me, at least.
So, I'm sorry, I forgot your name.
Dr. McNamara, Liz.
Oh, you're
Aria.
No,
Karen.
Karen.
Yeah.
So does this connect some dots, like these grants, if they come in with what Karen had concerns with in the county as well? Are those, does this address some of those, or are these two separate conversations in
I
terms
think
of
this
substance
does. We can provide services with medical treatment that the county can't necessarily there. And please correct me if I misspeak. The county is able to provide a lot of therapeutic services, but their physician services are mostly psychiatry and not specifically oriented towards addiction treatment. And so that sort of intersection into, let's treat this part. I have a lot of patients, I guess I can be really concrete about this. I have a lot of patients who see me for their substance use disorder and then see the county for therapy. And so their insurance coverage will get us kind of both of those things. And there's a very open, like, okay, our substance use navigator, this person sees mental health at the county, so they need to come here for this. We need more to close that gap. Like, less than 10% of people with substance use disorders get appropriate treatment. We really have a lot of scaling up to do. And then also making it, like I said, low barrier so people are willing to come.
And final question, is there any world in which is partnering with the city on grant applications helps strengthen the likelihood it gets approved, or is that not something? Is this?
How could I possibly say no to that?
I mean, the question behind the question is, like, is there something we should be I'm putting together a list of like what we should be advocating for when we go to the city. So is this one of those? Because obviously I don't know if the city has money, but if they are like a partner in the grant application, I don't know.
One of the things we could really use is within our program at Barton, we could use somebody who specifically does grant maintenance. Because when we started with, $100,000 just to pay the substance use navigator, that was really easy. But now, like I said, we have multiple grants with multiple different amounts. And, we've built this from basically two doctors being like, we want to do this thing. So having somebody who could be sort of our maintenance person for grants, also seeking grants, and then helping us to do budgeting and community interaction and partnerships, stuff like that would be a very helpful adjunct for us. And so we've been talking about that within our own team. Like, how do we add somebody here to be our administrator? Because it's too big for a couple doctors and one navigator. Like, we have too much work, and that's not my strength, right? So I guess that's the long answer to saying, yes, we need more help. Exactly what form that comes
sounds
in.
like a staffing issue, not a necessarily like, hey, we need a co-signer on this.
Yeah, so sorry, I didn't know that's what you were asking.
So I worded it clunkily. That's all.
Yeah, and I'm not like, I didn't do grant management before I started this, so this is very new for me. it's more staffing and support from that than co-signing. I haven't seen funds that are specifically contingent on that partnership, like having a hospital system and a RHC. That pretty much suffices the mandates. But more help is always welcome.
Any final questions? Anything we missed you want to share? Okay. Come on up, Chris.
I just wanted to build off of what Dr. McNamara said and to your question. I've talked with the city manager about this. It seems like as a small community, we're always chasing money and we're always looking for grants and grant funding. And as Dr. McNamara hinted, it's a challenge, and some might say, well, Barton should just hire a grant writer and somebody to management. We're actually considering it. But I think it's the same problem that we see in all of our partners, which is you need it right now and then you don't need it for a long time. So it's almost like we'd be very supportive of if the city wanted to maybe start some meetings to get all the partners together to talk about a way to maybe fund a professional grant writer and manager. Because I think what we see from the partners you heard here today, what we're definitely seeing in some of the partners that aren't here is a constant need to find the money and then manage the process to keep the money. And then the second part that might be good for the commission to share up through the leadership team is finding ways to use the money. Because a lot of times what we experience is, just today I was talking with our county partners. We've got roughly, $600,000 in grant funding that we're not able to find a use for. And so now what the state is doing is after they see these funds not be used, they start to claw it back. And so it's kind of a twofold problem. You need to manage it, you need to get it, and then you need to find ways to use it. So I just thought I would add that.
Is that because the 600K has such specific allocations to it?
Sometimes one of those grants, the $250,000 one, is something related to COVID services, so we just don't see that as much as we did, a few years ago. And sometimes because in the hospital example, we're already providing these services within our clinics. So we don't really, have the ability to do it outside the clinics, meaning in the community. And this is specific for community, kind of meeting people where they're at. The other case example is when we do our community health fair every year, we partner with El Dorado County and some other partners, and El Dorado County just brings all their team up to do vaccinations. So they're doing it as part of their community benefit, but I found out today that we could get a budget for them and basically use that money to help support that service. So it's really connecting the dots, I think, in a lot of ways, but I think other grants that I've been familiar with, it is very specific, and you have some tight timelines to try to figure it out. And in Dr. McNamara's case, if we had money 4 years ago, we really didn't have a program to use it. So it takes time to build it, and then be able to use it. So that's the other component.
So there's no world in which we can take that and create 5 more beds or, there's no...
We'd certainly be open to trying to make that world happen. But as it stands today, I don't think it exists within our community. And we're the right size community to do something like what I'm proposing. There's enough need, I think, through all the community partners to probably make it a full-time job, and we would just have to figure out the funding for it. Thank you.
Well, thank you so much for sharing that. Thank you for putting your presentation together, Officer Hazlett. I think we have to take public comments next. Is that correct, Dan? Thank you.
Were you completed with your presentation or were there more slides?
That was it. Yeah.
Okay. We can go ahead and open it up for
Okay,
public
cool.
comment.
Is there anyone in the room who would like to provide a public comment on this? And we don't have a Zoom, so again, thank you so much.
Thank you for having me. Thank you.
Great, that was very lively. I think one of our more active discussions. Next on the agenda is our SRO update. Chief, are you going to introduce first, or?
Just had to give them the signal they can go. I really appreciate them being here again. So anyway, thank you, Chair and Commission. So next up, I forgot to mention last time, but both of these items were brought at the commission's request at the last meeting. The next item that you requested was an update on the school resource officer. So again, before I introduce him, thank you to Officer Peterson. He's going to a 2-week summertime, so we send him to training in the summer. He's at a school right now in Sacramento, and I made him drive up here from Sacramento to come to this meeting. And when he's done, he's going to drive back. So thanks for making the trip. And again, this is Officer Tim Peterson. He's our school resource officer right now. Most of his time spent at South Tahoe High School. So thanks.
Thank you, Chief. Good afternoon. Am I the one that controls this?
Yes.
Okay, gotcha. Thank you. Again, my name is Tim Peterson, school resource officer. I've been a police officer for 9 years, and this last year was my first year as the school resource officer. So a little bit of a learning curve. Learned a lot so far, my time there. My understanding is the board just wants an update and an overview of what the school resource officer position is and what it's about and what I do. So to start off, first and foremost, safety and security of the school campus. That's been a kind of a hot topic issue with schools nationwide. I don't need to go into too much more detail about that. So having a uniform presence and police on school campus is very, very, very important. So that's the priority of my role, but my role goes much further beyond that. Investigate criminal incidents that happen on school campuses. This is very, very unique. I will say that my priority is not to pursue juveniles criminally. I take more of a educational route in collaboration with school staff and their input. It's very, like I said, it's very much educational. If we can take that route, I believe that's going to be the strongest route for the juvenile to grow and mature. Again, collaborate with school staff and mentor and counsel students. This was not necessarily a role that I expected when I assumed this position, but I'm very grateful that I did, because talking with students, there's a lot of students that have a lot of different needs, and they connect with people differently. And when I collaborate with, let's say, the school counselors, they have their own approach of talking with students. Most of the time it works great. Other times maybe the student has a little different need, and I go and talk with them, and I can actually succeed in connecting with that student. And that's happened numerous times. I have a lot of students that prefer to come talk with me or talk with me and the counselors in conjunction. And it's actually really rewarding. It's rewarding when that student comes later and talks to you, lets you know that maybe the advice that they were given or the direction actually improved their situation, that they're doing much better, or you see them out in the community, and you have that relationship with the student. So I'm actually really, it's really rewarding. I'm glad that that's a part of this position. As far as statistics, sorry, let me get closer to the microphone. As far as statistics, as far as arrests, there's only been 4 custodial arrests. Again, that's not my priority to arrest students or juveniles. We'd like to take a more educational approach to that. Sometimes, especially if a parent is involved, like let's say it's a school fight, sometimes you have parents that are insistent on pressing charges. So in that case, we don't put handcuffs on the student. We give them a citation, they get referred to probation. It's not necessarily that they're going to juvenile hall or they're going to experience anything of that nature. Oftentimes when they go to the probation department, they're going to receive counseling there and be referred to resources. So a cite and release citation arrest does not necessarily mean that they're going to juvie and experiencing that avenue. As far as mental health, I did have 2 incidents over this last 23-24 school year where I did have to take students to Barton Hospital will be placed on a mental health hold. And as far as non-enforcement actions, basically documentation reports. I had to write 48 documentation reports. That could be maybe something that could be considered criminal, that we decided to go a different direction, but it was important enough to document. It could be reports of bullying, it could be allegations of child abuse, any number of things. And then we have, on the right side, we have the breakdown by school. As you can see, the high school, where I spend a majority of my time, is also the most active. Obviously, you have older students, need a little more help and guidance. And out of the high school, there's 12 arrests, 33 reports. Mount Talac High School, 2 reports. And South Tahoe Middle School. The middle school is a very unique position because of the age range of the students. Because obviously it's in between elementary age students, where you're not necessarily going to see crimes happening, and high school students where you might see a little bit more criminal activity. So because of that, oftentimes the middle school will solely deal and handle incidents that happen at the middle school, at their level, at administration level. So there's a lot more. I have contact with students at the middle school. It's more of an unofficial capacity, maybe not necessarily documented in reports, but that's kind of an explanation about that. And then as far as the elementary schools, I have two Tahoe Valley, one at Bijou, one at Sierra House. I will say Sierra House does not fall into my jurisdiction, but being the school resource officer and that being a part of the LTUSD school district, I do sometimes go out there and assist the schools that are outside of my jurisdiction. And the reports generated from there, just simply maybe concerning behavior, out of the ordinary behavior, something, okay, we need to keep our eye on, maybe refer the student to resources, see what we can do. And this last school year hit the ground kind of running. So there's 2 incidents of note. Am I saying that right? I feel like the echo just makes it feel weird. Incidents of note. Okay. So the first week of school, we got a report of a threat of a school shooting. Again, very hot topic. That would be tragic. Nobody wants that. I'm super glad that it got brought to our attention. After a thorough investigation in collaboration with our detectives, writing numerous search warrants, the student in question, for all intents and purposes, it appeared to be a very valid threat to the school, and through the work of everyone, including myself, luckily that was averted. And that student's last update I had is they were sent to a treatment facility. And the next incident of note was like 2-3 weeks into the school year. We were at a football game. There was a fight that occurred, and information kind of slowly started coming out. But at the end of it all, the report of a student that was carrying a firearm that got in a fight with a group of other students, that turned into a rather big investigation as well. And that I just brought these up to highlight the importance of the school resource officer being on campus, being able to be that presence, because incidents like this do happen. And that concludes my presentation.
Thank you. Go ahead, Tom.
I see these are 2023 statistics. Do you see any trending from last year to this year?
I don't have that information.
You don't have any? Okay. Anything changing in the 5150s or more arrests on? I see you had 2 weapons issues. Any more this year?
For the 2 I highlighted, yes. However, there were a few more additional weapons violations that were reflected in other reports.
Can I just clarify one thing real fast? He means the 23-24 school year, right, Tim? This school year?
Correct.
Not the previous school year. So this is just 1 year's data.
Oh, you go first. You go. What's the difference between a custodial arrest and an arrest?
A perfect question.
It's
So-
probably a dumb question, but thanks.
Thank you for asking. So a custodial arrest would be the traditional hands behind the back, put handcuffs on, or transporting to juvenile hall, where you'll be booked in, parents notified. What you think about when an adult gets arrested, it'd be the same thing, just going to juvenile hall. Where a non-custodial arrest means no handcuffs, usually citation. Typically, that falls under misdemeanor crimes. So not, yeah.
My brother-in-law did what you're doing for 40 years in a high school, and they didn't call it an SRO back then, but he was a counselor handling they had a term for the most difficult cases. And, I know that it takes a very special person to do that. So, congratulations and thank you so much. I was curious, do you talk to the whole student body every year to introduce yourself and build that rapport? Because it sounds like you have a great rapport, and it's obviously so important. I was curious what you did to manifest that.
I can't say that I've spoken to the whole student body, but you probably have given the principal an idea.
Yeah, I think that's a great idea. I know he loves public speaking, and we'll make sure that gets on the calendar for next year. I'm just kidding.
However, no, my interactions with the students, it could be individually one-on-one, whether they come into my office. I usually have a little jar of candy. It kind of baits them in. Or being on campus, perusing around. Some kids like to come up and talk. It could be being at sporting events. It could be interactions, maybe there was a school fight or a problem between students, and that's my first interaction with the student. But it turned out to be a positive interaction, so then therefore they see me later. And then they're with their group of friends, and then so now I'm associated with the group of friends because of my one positive interaction with that student. So through numerous and various interactions like that, I build my rapport with the student body.
Thank you.
Mm-hmm.
Tim,
Yes, sir.
talk about your benefit of your knowledge of all the student bodies and how that benefits patrol and detective investigations.
Absolutely. So obviously, most students, most juveniles, they're not going to be in a police system, and rightfully so. And so when there is a need for patrol, let's say, or detectives, and that might not even be criminal. It could be something like a missing person or like a runaway juvenile or assisting another agency with something. Oftentimes they can come and ask me, and I might be able to recognize the student in question, or let's say, hey, do you recognize this kid? You get provided a picture. Either I can recognize them or I can share it with school staff, and sometimes we can recognize the student from there. Or if there's information that's needed for anything, the school has its own computer system with all the student body, and because of my position and my liaison between the police department and school district, I can facilitate that. So it's very beneficial.
I'm assuming you take, I don't know, classes or have extra training in whether it's mental health or interacting with juveniles. And so can you talk a little bit about what programs you've been through or what, to be able to, you know what I'm asking.
Absolutely. So I have been through crisis intervention training. So that's good with teenagers, emotions often fluctuating. Sometimes it gets to the level of like a mental health crisis. So having that training and learning ways to talk with someone going through a crisis like that, or just having that empathy or sympathy to connect with them on that level has been super important, and so that's been a good training, the crisis intervention training. The other training was an actual school resource officer school. It was a week-long school, I believe that was back in March I completed that. And that's just an overview of student law, ways to connect with kids, ideas to help the community, whether that's there's kids that are running through the neighborhoods after school, or they're going to shopping centers and there's theft being committed. So suggestions on how to create relationships with the community outside of campus that may have some sort of connection to the school campus as well.
I have a question just in terms of one of the ongoing national conversations on student resource officers has been the disparity of treatment of students among certain racial or ethnic identities. Are you seeing certain interactions in your role with certain ethnic groups? I mean, obviously, this is a little bit based on perception, and I realize that you can't always tell someone's ethnic background, but are you saying, like, what does that look like at South Tahoe High or in these other areas where you're interacting, and how the students interact with you?
So I would say the student body majority would be Caucasian and Hispanic students, and I feel like I have equal interaction with both races. Trying to remember if there's another part of your question.
Just like how you're feeling those engagements are going more positive.
Oh, absolutely.
Like in generally with
absolutely.
With the different ethnic groups.
And I think that goes back to creating that positive interaction with the student, even if they have committed a criminal act where there could be enforcement action. Explaining that to them and saying, well, that's not the direction I want to go. I want to see growth in you. I want to see maturity. I want you to learn from this experience. And showing that leniency and that grace. Oftentimes it's more of a positive effect. Very, very minimally will someone actually come back and continue bad behavior after an interaction that I've had with them, because they're like, wow, I could have gotten in a lot of trouble. I could have gone to probation. I could have had this reputation. But the cop and the school staff like kind of took grace on me, and I got detention when I could have went to juvie or I could have got referred to probation. So, and that gets shared amongst the other student body. And they're like, hey, this cop's cool, or I like this school staff member. So when we can go that direction, we absolutely do, and it does create positive interactions. A rewarding story I had was at Mount Tallac graduation, which was at the community college. So while I was there, a group of Hispanic boys came up, and we were all talking and laughing and joking around with them. There was actually a former school principal for Mount Tallac that was nearby. I don't know this person, but they saw that interaction and made it a point to actually come up to me afterwards and thank me for that. And she explained how the expectation is like males and male minorities and cops don't get along. And she was actually very impressed and thanked me for being able to have that engagement with these students. So I appreciated that.
I'll just maybe make a little bit of a comment here. Wearing a couple of different hats with this. One, I have a unique insight here into some of the questions here. A couple compliments. One is, as we all know, high school age kids really look for respect, and Officer Peterson, you lead with that consistently. Firm, fair, and consistent. And I think therefore kids respond to you well. I'll ask you the same question that I did last presentation, this time on behalf of the school. If there's anything else that we can do, right, to improve what we're doing, hey, I want to be part of that. So I don't necessarily need an answer from you here, but if you wanted to share anything, I'd love to hear it for the council.
I think we're doing a great job. I love being able to work with you and the other school staff members. Very receptive to anything that I have to say and vice versa. And I'm really proud and glad and appreciative of our relationship. And we'll definitely connect later to discuss anything that we may need to.
Thank you.
I just want to say, Chief, I think you got the right people in both roles.
Thank you. He'll tell you what he needs when I'm not sitting next to him. That's what he.
Second SRO. How about? Second SRO.
All right, I got a tougher question, but I want to be clear, this is not about you. You seem great, but you might not be in this role forever, and we need, I just want to understand what the safeguards are in the future. I went to a high school with not a great SRO officer, they were called something else. So what is the process for which a student can file a formal complaint if needed, or have, be able to hold accountability if ever needed? Again, not implying anything here, just as a process question for the future if we are.
Just for clarification, against the school resource officer?
Yeah.
Okay.
Yeah, sorry, but I have to ask the question, yeah.
Scott Crivelli, for the record. I'm the patrol lieutenant. So there's all kinds of ways that complaints can come in. It's no different against an SRO as it would be for any officer. Obviously, since they're juveniles, it would need to come from their parent because they're not 18 years old. So they could come to the supervisor. I'm sure if they complained to Mr. Zunino, I'm sure that would get back to the chief or me or sergeant or somebody. But there's all kinds of avenues of communication. A parent could call and say, hey, I'm not happy with XYZ. There's all kinds of avenues to where it would get back to us. And, as for he wears a body camera at school, like all the same policies apply to him, what he's doing up there, that any other cop is doing on the street. So.
And can I just clarify one thing for Commissioner? We would accept a complaint from just a kid. It would not.
What if there is no parent at home?
If they have something's going on, we would take that complaint.
And I agree. It is a very delicate position for an officer to be at a school, and it could be successful or it could be a failure. So we take that very seriously for selecting the right personality to be in that role. I could not do it personally. So I have a lot of respect for the cops who can work well with kids and wear those hats as mentor and officer. And I think having kids yourself probably helps that a lot. So thank you.
I have two last questions, and I'm asking them to help make your drive up here worth some of your time a little bit. But my first question is, Chief, do you know, are the arrests from the schools subject to the same, I forgot the acronym for the stats you guys have to report back to the state? The
RIPA,
RIPA, yes.
He's subject to RIPA data as well.
Okay. And then the second question is, I just want to know if you have any interactions or like if you take advantage of Officer Hazlett and the Stacks team as well, and how those interplay with your role.
I would say it's minimal, being Officer Hazlett's role, mental health and homeless liaison officer. The school district actually has like their own homeless outreach person. So oftentimes if there is a concern of homelessness, that's like their first stop and referral, and I might not even be made aware of it. Just happens on its own. But if a need ever did occur for like a homeless issue, absolutely I would call Officer Hazlett. I have a great working relationship with him, even before I was in this position, and I would definitely utilize him. As far as mental health, I only had 2 incidents of that, and it was just kind of a situation where I was in the capacity to take care of it.
Go ahead.
So earlier this summer, just as an example, what Officer Peterson said is correct. There's not a whole lot of overlap, but in the few times that there have been, it's gone really successful. I had one where I was looking for a juvenile. I think all I had was a first name, and that they were within the city, and that they said they had done things to harm themselves. Very, very minimal information. And we were trying to find this kid. And it wasn't me personally. I was calling everyone I could think of, and I think I had the watch commander, hey, can you reach out to Officer Peterson, reach out to the SRO and see what he can figure out. And Officer Peterson figured out almost right away, with his ability to get into the school, the information and all that, and just his knowledge of who these kids are, figured out who it was, where that individual lived, and we were able to respond there and find that individual and get them to the hospital. and, provide them, with what I do, the follow-up care afterwards, and provide more mental health services to them as well. So there isn't a lot of overlap, but I think that one example where it was kind of a crisis situation, I think it worked out really, really well for us. So.
Thank you.
Any final questions? Now, if I'm doing this correctly, is that the end of your presentation?
Yes.
Okay. So are there any public comments to be made from anyone in the room? There's no one in here? Okay, so great. Thank you so much, Officer Peters.
Thank you.
And have a safe drive back. So up next is city staff reports and announcements. So none from the clerk. Dan, any reports?
Nothing to report.
Okay. Chief, any reports?
We're still hiring most positions. So strongly encourage anybody watching to go to the city's website, Human Resources page, and find the links. We have one police officer position we're hiring for. We have one CSO position we're posting very soon, one parking ambassador position, and we always, always, always need dispatchers. Anything else? Okay. One more quick thing. We did have our National Night Out event last night at the TJ Maxx parking lot at the Y. Us, Highway Patrol, El Dorado County Search and Rescue, and some other community partners came out, set up shop out there in the parking lot. We had just a thank you to my crew that was out there and the allied agencies. We had a really good turnout. Lots of people came by, asked questions, took some free trinkets and stuff like that. So it was a great event. So appreciate the help. Yeah, it was good turnout. So that's it.
Okay, now it's time for commission reports or announcements, and this is our opportunity to put anything on the agenda. So does anyone have any ideas? Keith and then Tom.
Kind of segueing off of as we asked them on both reports to, give us going forward, giving us, their wants and needs that we can share and with the city council. I was just wondering, maybe this is done periodically or regularly, but I don't know if maybe the chief wants to put out a top 3 or 5 wish list items for us next time to look at in the same vein of some of the needs of the department.
So they have an annual report to council. I don't know if the chief has had experience with any other frequencies.
Yeah, I guess if that's going to be an agenda item, I need a little bit more focus. Like, do you mean specifically to the 2 presentations we saw today? Like, is there something more for the Stacks program or something that I was, a wish list for the school resource officer? We do have the report coming to council, which is kind of dry. It's just a summary of what we discussed over the year. That does come at our next meeting in November. The chair, I believe, is going to report to council as well at some point during commission reports. As an agenda item, I guess, it's a pretty broad question, like the top 3 things the police chief wants. I'll come up with a list, but I guess I would just ask for clarification.
Well, I was at the last meeting, we had the annual report, and it seemed to be left open to interpretation by the council on what needs might be most important. So I just thought something a little from your perspective, a little bit more concise might make some more sense.
Gotcha. Yeah, the annual reports are really just designed, the police department annual reports designed just to be a report out, not an ask of what I need. That's usually hashed out between me and the city manager in the budget process, et cetera. So, but I'll have to think about that.
Isn't there typically an annual police advisory commission report as well?
Yes, that's the first one I was talking about. That's the one that's in November that every commission submits back to city council. It's usually written by the city staffer in charge of the commission, and that's the one I've done the last 2 years.
So that may be a good opportunity.
I can certainly put stuff in there. So
I'd like to jump on that a little bit. I don't know if this is what you're getting at, but it's something that I wanted to say, which is I think what we talked about last time, and I think you've done this now once or possibly twice, correct me if I'm wrong, gone to city council outside of the annual report to report back?
No, I have,
We've
since
just
I
talked
decided
about it.
that, I've talked about it. So
Yeah.
my plan was to do next city council
Yeah,
meeting,
so I
our first
think-
report out.
I mean, we see other commissions do this where we can come into the public comment at city council and say, hey, in our we only meet once a quarter, so it wouldn't be every city council. But in our last meeting, this came up, and as a commission, you know, we support. And I took some notes on some of the asks or some of the, you know, even just something as simple as like Stack seems to be working, and, you know, as a council, we urge you to talk to them directly about what they need. Yeah, so if you're planning to do that, I support that. Would love if everyone else supported that, and so you can go as a unified voice. And the other thing I wrote down was, I think Angie's statement was to add to that list to city council, her request.
Yeah, I think there's two things here, right? I think my plan was, we didn't quite, I didn't do a recap over after the last police advisory commission meeting to go to report to city council, so I will be doing it on Tuesday, and that was my plan too. But I wanted to make sure that we were all on the same page, that we all agreed like about talking about the ongoing support for Stacks, and then also just report out on the SRO officer presentation. But then I was going to ask too if we also wanted to report on agreeing to support the suicide prevention proclamation as well.
I will say that I've already received the proclamation from Angie,
Okay.
and I will be bringing that forward at the end. Anytime someone asks for a proclamation, they just email me,
Okay.
and then I bring it up at city council. But you can say, she came, we
Right.
support it, and then I will be bringing it at the end of the meeting, and then we'll be presenting it in September.
Okay, I just wanted
I
to,
can't imagine a world they say no, but it's not, isn't, like, she came here, it's nice to say we also support it. It doesn't,
yeah, I just wanted to make sure we supported it. Everyone agreed to support the proclamation, so we could say that we support the proclamation in the report. Does,
Yeah, is that a vote, or is that just,
I
we all nod
just,
our heads? How does
I
that
think that's
work?
just a nod. Or Dan?
Well, it's not an agendized item. I don't know if, at this stage, if we would be making a motion for that specifically.
Maybe just a thumbs up of everyone who agrees with supporting the proclamation. I think that would be good. Yeah. There's consensus to support the proclamation.
I just didn't want to support the proclamation if someone had a resounding no on that, but I'm glad to hear that we don't. But then that gets us back to Keith's item about the top 3 wish list or whatever that looks like. I don't think it's a bad idea to me, because what's the next date of the next meeting?
I know, it's August 27th, because it's the day Barcelona comes to San Francisco, so. it's the-
October 27th?
August 27th is the next city council, is that what you were asking?
No.
Oh, sorry.
That
That was just my opportunity to talk about Barcelona.
No, I appreciate the Barcelona shout out there. More when is the next police advisory commission? Because if we can get that in before the report, then we can help, support or whatever you need in that area.
I think it's November 6th, but if I can just step
it's
out
right,
there.
it's right around November. It's right around that time.
I can step into the hallway, it's posted out there, and I can let you know.
Also, just to clarify, the next meeting, city council, is next week.
Yeah, I go to that one.
It's not August 27th? Or there is one on August 27th?
Two meetings in
There's-
August.
Oh, yeah.
And I've heard they're both morning start meetings, so.
November 6th.
So is that before or after your report?
My report to council for a summary of Police Advisory Commission activity for the year will be presented to city council after the city council meeting occurs after our Police Advisory Commission meeting. I think that's the way I planned it out.
So he could present it to you and then take it to council.
Yes. So
That's
I'll be-
usually how
yeah.
it goes.
I will bring that to the agenda for November, the annual report for the Police Advisory Commission. You guys can give me comments, we can, whatever you want me to add or change or adjust, and then I present that to council, I believe it's the very next Tuesday. I tried to get it before, so it's, because it's silly for me to present it to them and then bring it to you, so that's what I tried to get it.
Go ahead.
So it sounds like we could have a motion at that time to see what direction to give to the chief to add to the report in terms of specific recommendations for stacks and SRO, et cetera.
So then is it best to agendize the discussion on the report or agendize the wish list?
Got the buttons on these, I'm sorry. I think that you remember your commission report out to city council can communicate the support for the things you guys already heard today and talked about. I'm going to sit on my hands. And then any recommendations, like formally, that we present to council could be done at their November meeting via the annual report. And then we just don't second his motion and it doesn't, then it's just done and we move on to the next motion or agenda item request. If that, because I think it fulfills that.
Are you comfortable with that, Keith?
Yes.
Okay.
Thank you.
Great. Are there other ideas for November on what we should discuss? It's always really hard planning this far in advance. Go ahead, Tom. Oh, sorry, Tom. I did forget you. I'm sorry.
Most people do. I just wanted to let you know I'm chairman of the Christmas Chair, and we've hired a new executive director this year. We're open Tuesday, Wednesdays, and Thursdays, 11 to 2. If you want to donate, our office is 1120 3rd Street as you go down to Barton Hospital. We serve about 1,000 people a month. A lot of them are single women with kids, and we're very proud of that. So if you have any food to donate or want to donate money, we appreciate that. It starts slowing down a little bit now, so we're trying to ramp up our fundraising effort for the fall and for the holidays. So thank you.
Chief, is there anything we haven't seen from your department that maybe we should be looking at? I mean, you've presented on a lot of different things.
Yeah, I presented a lot of things. I think I've hit the important stuff twice now. These two items were like the last two big ones. Right now on the agenda for November will be the annual report, number one. It's been suggested to me that maybe something on short-term rental enforcement. I don't know if that's something the commission is interested in. It seems to be a community topic that comes and goes. I could bring that back if there's interest from the commission. If not, that's fine. But I will, I'll go back and look at my big stuff list if there's something to bring back. It's going to get, again, very busy right after that with the new year and the first commission report and the elections, and then AB 481 and all that sequence is going to start over again. So, but I don't have anything off the top of my head besides the annual report. But certainly, if there's another issue that you guys want to hear, training is in my head, but I just can't formulate like an actual agenda item on that topic right now. But I'm one of the topics that I haven't really hit the commission with yet. So,
Yeah, I mean, I personally like the idea of an agenda item for short-term rental enforcement. I do think there are certain things coming up in the next election that probably that information might be helpful for voter information just as a whole. Is anyone else interested in that?
So I think our meeting is on or during, right, the same week of the, yeah. I almost wonder if we hold that for the next one, once we see where, you know. But I don't know, I don't feel strongly, but I just want to point out, I think it's, I don't know how.
I think my timing is just as good as your Barcelona timing in terms of not knowing the calendar. That's a fair point. Any other commissioners have any feelings on that?
Yeah.
Because I know, we could just push it and we could just focus November on the final report.
November 5th is the election. So
Oh, yeah. Okay. So we're right after. Yeah, I mean, I'm down with just focusing on the report.
If I have something else, I'll add it.
Okay.
Chair, I think you were going commissioner to commissioner for reports too, but we got distracted by agenda items.
Wait, say that again. Sorry, I just short circuited.
Go ahead, Dan.
We may have some additional commissioners that still have to report their activities if they've had any to report.
Okay. So does anyone have other things to report?
I will just compliment the police department for the, this time of year with the influx of people coming into town and all of that comes with it, the work that's taken place and so compliments to the force on that. And also, as Chief just mentioned, a little bit around training, I think that would be something of interest as well down the road at some point when that's works out. So I think that would be great to talk about that a little bit, take a look. Thank you.
Did someone want to give him a second to bring that item back?
Sure, I'll
That's-
second that.
Oh, that's way too broad, so. Motion and a second on police training, it's a huge topic. I can, if you just give me the flexibility to kind of narrow that down to some required trainings, post trainings, kind of a spectrum of stuff that occurs in our world, it's a big topic.
What if we just gave him whatever you think is best, and then after that report, we can maybe narrow it from there for the next meeting and say, okay, this is where we feel like there's missing that we'd
You
like
could
to
drill
change.
down on it after that.
Absolutely.
Okay.
Yeah, latitude, I think.
For the November, what do we say it was, 7th, 6th? 6th, day after the election. Who planned that? I will add an agenda item on police training on that agenda.
You definitely want it at the next meeting?
It doesn't necessarily need to
I
be the
just, I'm
next
trying
meeting.
to.
I can push it to the February.
What is the timing?
I'm
for-
more like, should we be having a police commission after the next election?
I know.
Sorry,
Like,
do
go
do we
ahead.
have a
Should we
second
give ourselves
a
on,
week?
on that request?
We did.
We did.
We did get a
Okay.
second. So does that mean it has
It's
to
at
go on the
No,
November?
it's the commission's pleasure. If you want it on the first meeting of 2025, that's fine too.
No, I wouldn't push it farther. It was only if we could push it a week, but if not, then I think we keep it.
For November.
Yeah, it was more just like.
Oh, I got
think
you.
we're gonna have a lot of.
If we push the meeting a week, then it's after the city council meeting, just for your guys' thoughts on that. I think.
Okay, so.
I'll bring it back. I'll bring it back on the 6th.
Bringing it back on the 6th.
Yep.
Okay, that sounds good. And we did have a second on that. Yes. Okay, great. Am I missing anything else? No? I think, one day I'll master this, Dan. And so with that, I think our meeting is adjourned.